similar patient, or I'm sorry, different patient. I checked everything. I asked her history. I asked her if she was any chance of pregnancy. But this is going to be her left second digit. Okay, left second digit. All right, so we're still at 40-inch tabletop. So just rest your hand up here, however is comfortable. Is that how you would be for comfortable? Okay, so if that's her comfortably, then I'm literally just going to pick up her arm and I'm going to move the IR to her and attempt to look where the middle is and put the middle of the IR near her second PIP joint. Does that make sense? Let me turn a little bit so you guys can see. Might not be able to get in. So what I'll do is, you can actually just lift up for a second. I'm going to slide the chair back.
Oh,
like stand up for just a sec. Okay, good. There we go. Now just bring your arm up here.
You don't have to be in D10?
Not for tabletop. Okay, if you guys really struggle with midline, what you can do is line up the light on the edges of it. Like those lines are right on the edges of the middle of the IR. Does that make sense? Mm-hmm. So I could do, if you really struggle with where the middle is, do something like that first, and then lift up for me. I'm just going to move over a smidge. So PIP joint is going to be my central ray for all of these. Okay? Don't be ready in my face.
On the button?
You what?
You had to hit something, that's why.
You hit the exposure button.
Sorry.
He's looking at
How
it.
did you do it on accident?
No.
So how did you do that on? I don't know that it was. He might have done it. Okay, so right second digit PA.
So you're basically coming down like between.
Yeah, I don't even, honestly, I'm not even looking at that because I know I want to fit my marker in there. I just know I have to be on PIP.
As far as like cognition though.
That's funny. I really was looking at that and going, okay, my marker is going to fit in
So you
here.
get invited to the funky
So-
pelican anyway, I guess.
If I do that, that's all I would do.
So you wouldn't worry about this.
No, because what it says in the book
Then as
is
long as
I
your
have to
marker
get,
fits and you're good there.
well, I have to get proximal, middle, distal, and I have to get the distal end of the metacarpal. So
Okay,
I
so as
know
long as
that that's,
passes the-
if I was too tight, if I'm like that, I'm never gonna
You're
get
not gonna
distal
get this far.
metacarpal,
Okay,
correct.
got it.
Alright, so on PIP, this is PA, second digit, left marker's up there, collimated side to side, she's shielded. Technique's gonna stay the same, so I'm gonna go shoot that.
Don't shoot.
I'm,
Don't shoot my
I know.
little buddy.
Alright, I'll get the sponge just to show you what it would look like.
Every time you say she shield, I think of like the commercial that's
She should.
yeah, the she or she shit, the lady with the she shit.
Oh, the
Yeah,
shit.
she shit.
Okay. Without the, let's see. Okay, I'm thinking, medial.
I know.
Okay, so this is a 45-degree medial oblique, okay? Which means her hand is gonna roll in this way. I don't know if I wanna use this one. The biggest thing with this is that the finger has to be parallel. You guys, I know I say we're not competent,
Listen up.
but you're driving me bananas with that. If you don't want to hear, I still want to say it. So, originally her finger was down, but that's not parallel. So we're going to lift that up, and then she's a 45-degree medial oblique, meaning her hand is rotated medially, and you're looking at this angle right here to be 45. But the bigger thing is, in order to open those joint spaces, this finger has to be parallel to the IR, which if you can send that video, are you videoing?
Yeah.
Go turn it down so you can see from here to here. Is that finger parallel?
Yeah.
That's the biggest part, okay, to open those joint spaces. So we're still at
This is a medial lateral, right?
a 45-degree medial oblique.
Medial like okay.
Correct. It's the oblique view. It's the angled view.
Because the medial is closer.
Because you're rotating the part towards the middle. Alright, so left marker, same technique. she's shielded, that's good. Even though her finger's not touching, it's still parallel, which is most important. So I'm gonna use that. You can unlock that. Alright, so that's the 45-degree medial light. You can relax. The next one is the lateral. Alright, so on that one, what I want you to do is just kind of roll your finger and bend your other fingers in. Good, perfect. Now, when you're videoing, do you see how her ring could potentially obscure
Yes.
because of where it is? So, I mean, I could ask her to take it off. She could move it out of the way. If she didn't want to because it's her wedding ring, she could just tell me I'd rather not take that off. And then I would just have to note on there, patient unable or unwilling to remove wedding ring. And then hopefully wherever the issue is wouldn't be in the way. If it was in the way, I could attempt to get this finger out. I mean, I could attempt to do it that way as well.
I mean, couldn't you just tell the patient, like, your ring's in the way?
You could, but I'll be honest,
Some
I
haven't taken
wouldn't
their
take
ring
it
off for
off.
20 years.
Really?
Yeah.
I wouldn't.
Really?
I
There's
wouldn't.
people that haven't, like, I know
Oh,
some
yeah.
that never did their
Oh,
ring
I
off.
didn't know.
Yeah, I wouldn't. But I mean, if you told me like, okay, that might be in the way, I would do everything I could to get
To
it
get
out of
it
the
out,
way,
yeah.
but I probably wouldn't take it off. Okay, so that
I'd be
actually
afraid
looks
I'd lose it or
better,
anything.
because now her ring's out of the way. This is perfectly lateral, and central ray is pip, so I'm gonna bring it up just a smidge. There we go.
I was supposed to
There we go.
move.
If it's just a little bit like that and you move the patient, I'm not anal with that. I just didn't, the least times you can pick
Move
up
the
and put
patient.
down and move them, yes. Alright, so parallel joint spaces will be open. It's lateral markers in there and she's still shielded and technique still on the side. Feet, good, you can relax. If you had to use a sponge, if your patient could not medial oblique, what you could do, I'm never gonna get this right. You can have them lift up like that and use the sponge just, I'm trying to
The
think.
other way.
No, what's a
This one?
medial oblique? You mean this?
Yeah.
What's that gonna do?
No, it would be like this.
Yeah.
But I'm trying to do the second.
This?
I think when they show it, it's just roll this hand up a little bit.
Just wanted to touch it.
I don't like the sponges. I mean, you could do something like that. We still have OID. Sometimes they'll use this too to like, separate to hold, I don't know.
Yeah, I have no idea.
I'm not gonna teach you the sponge. You guys are fine. The hand you might
Would it
need
be
the
like on that
sponge,
side, like holding it?
but that's lateral, so you
Oh,
gotta hold
medial,
that
so-
way. But then I want it down because I don't want as much
Oh, I
OID.
need.
So where's your button?
Have to be like that, and then just leaning on it. Maybe.
Yeah. But
So
see,
how
that to
does
me
that
is
help
more in
you?
the way.
Put your knuckles on
It
the other
doesn't
side of
help
the
her and it doesn't help me. A lot of times though, who was Brittany this morning was shaking. So if her hand was shaking and she's like that, then something to rest their hand on gives
Would
them
make a
more
difference.
stability.
Oh, if they couldn't keep their finger up, to keep it like parallel.
I don't
Would you,
know
is there
why, I was
something
just
you could
like,
put
my
under
finger
that
was
to
literally
hold it
like-
up, or
Can you put like
if someone
a-
did
You could
I
put
would
like,
put like a
cotton. Yeah, I don't know if cotton would really work, but sometimes this is like the thinnest one, but that's kinda thick. But I don't know that they have these in the field, but
Yeah, cause
if
even
you
then, that
couldn't,
would still
right,
be,
and I mean, you could,
like if they
You
just
put it in
couldn't
this
hold their,
yeah, I mean, wherever
Maybe
the
the tip
tip
or
was,
something,
yeah, you
yeah.
could do
It's
that.
your job.
At least that would be radiolucent. Most patients, I feel like, can do it, or whatever the injury is, you just state that on there,
or
like,
like
you
if
know,
it
if
was
they,
broken and they couldn't move their finger to physically hold it up
Right.
or something, you could do,
right, or you could use the popsicle stick to kinda hold it
hold it.
underneath it. Where did I put that? Is it under your leg?
Just sitting on
Right.
it.
The
That's
popsicle
six,
stick.
yeah.
Under your,
It's sitting under you.
Sorry.
yeah, you could just, I could just have you hold
Hand
that,
that and hold it like that.
yeah,
Interesting.
behind your stick.